Hello, ladies and gentlemen, and a very warm welcome to today's talk show, Kidneys at Risk, Empowering Patients Through Early Hyperkalemia Detection and Education. This initiative is brought to you by the Integrated Health and Wellbeing Council in collaboration with AstraZeneca. As many of you here might know, hyperkalemia, characterized by high potassium levels, is a potentially life-threatening condition that often gets overshadowed in general kidney health conversations. But the truth is, it deserves far more attention, particularly among patients living with chronic kidney disease, heart failure, and certain medications. Together with AstraZeneca, a global science-led biopharmaceutical company, the IHW Council, India's leading health-focused think tank, aims to raise awareness, empower patients, and spark early conversations with regards to hyperkalemia. Through today's session, we're not just looking at data or clinical charts. We're here to listen to real voices, explore the emotional and financial journeys behind the diagnosis, and ultimately help shape a more empathetic and informed approach to kidney health. We are honored to be joined by an esteemed panel today. We have with us Dr. Prem Prakash Varma, MBBS, MD, and DM Nephrology, Ms. Vasundhara Raghavan, CEO and founder of the Kidney Warrior Foundation, Mr. Sambhav Verma, patient advocate, and Mr. Shantanu Saha, Director of Human Resources and patient advocate. Thank you so much to all of you for being with us today, and we're looking forward to a fruitful conversation to help raise awareness about hyperkalemia. Over to you, Doctor, to kindly moderate our session.
Thank you very much. As you already mentioned, that today we are talking a very important topic, especially for kidney patients, that is hyperkalemia. I think before we embark on hyperkalemia, it is worth knowing a little bit more about potassium. See, potassium, sodium, and chloride, these three are very important ions. For any cell to function, sodium and potassium are required. Rather, on every cell membrane, there is a sodium-potassium pump, where sodium generally is thrown out and potassium is pushed in. So sodium is generally in high concentration in blood, what we find 135 to 140 milliequivalents per liter. And because the potassium gets pushed in the cell, so it is mostly intracellular. So extracellular, the potassium concentration is 3.5 to 5.5. So the term what you are using, hyperkalemia, when we use if the potassium is more than 5.5. Again, what is important is how fast hyperkalemia has developed. There are dialysis patients who are carrying on with higher potassium and nothing happens to them. That is a chronic hyperkalemia, which is well tolerated by many people. Whereas acute hyperkalemia is dangerous. So it is the fastness with which potassium has risen that is important. Now, if we talk a little bit more about potassium, potassium is very good for health, for normal people. We all teach that eat a lot of fruits, eat a lot of vegetables. That is the DASH diet actually. Because more potassium you take, blood pressure becomes lower. More sodium you take, the blood pressure becomes high. So, to keep good health, that the blood pressure of a person remains in good shape, we have to take good helping of potassium. As a matter of fact, if you know, the requirement is something like 3,700 milligram, or roughly 3.5 to 4 grams of potassium you require every day. There was a survey in US advocates 4,700 milligram of potassium every day. There was a survey in US, only 3% of the population was taking ideal amount of potassium. They were taking less potassium. Now, why the hyperkalemia should develop? 90% of whatever potassium you take is excreted by the kidneys in urine. And 10% is excreted through gut, that is through stools. So any person who will be vulnerable for hyperkalemia logically, a person who has got kidney acute or chronic kidney disease, they are the most vulnerable people to develop hyperkalemia. So if you ask who are vulnerable, first I also must mention there is something called pseudo-hyperkalemia. Many times we keep pressing with tourniquet, or we keep pressing our arm to give blood. And whenever we press our muscles, potassium leaches out of that. This is pseudo-hyperkalemia. As a matter of fact, the commonest cause of hyperkalemia is pseudo-hyperkalemia, that the blood sample taken is different. So that is when you say, let's not press or squeeze or put tourniquet, and take a repeat sample. If you find a person is absolutely healthy, there's no problem, and you find his potassium level is high, so it will be advised, please repeat it and take precautions that you are not compressing it. So that is one, we talked about pseudo-hyperkalemia. Second, we said acute or chronic kidney disease. Third important fact is drugs. There are many drugs people are taking, like we say ACE inhibitor or ARBs, which are used for hypertension, spironolactone, which is used for heart failure patient, NSAIDs, painkillers we are taking. All these medicines, some of them, they are causing hyperkalemia. So you must take history, that is the person on any of these things. Keep in mind, one of the common things what we are taking, all of us, salt. Most of the salt we know is sodium chloride. But all these other salts, we call it Senda salt, we call it rock salt, we call it puro salt, we call it Tata Light, whatever salt. They are salt substitutes, which are good for health otherwise, because they contain 15 to 25% of potassium chloride. So if the kidney patient is taking those salts, it is a poison for him. For a healthy person, this is wonderful, because you are taking somehow more potassium. You are reducing sodium intake, the blood pressure will be less. Potassium you are taking, it will be good for your health. But this may be very bad. So we will not go into other details, what is called the hypoaldosteronism, etc., which are other factors also, which are there, which can give rise to. But we have to keep in mind that renal failure, the hypoaldosteronism, certain drugs, which are important causes of our pseudo-hyperkalemia. They are the important causes of hyperkalemia. So therefore, we have to be careful. And what hyperkalemia will cause, we will talk more about it. I think first we have got our friends here. Mr. Shantanu, I'll ask you first.
Sure, sir.
Incidentally, you must know Mr. Shantanu is a very avid, he's a business management person, and he has started a couple of businesses. He's a renal transplant recipient. Rather, he has received 2 transplants. So he has had a long journey of kidney failure. As a kidney failure patient, you must have had sometime hyperkalemia.
Yes, sir, of course. So, I mean, the first time I got to know about this was during the first dialysis sessions when I went, which was way back in 2011. I had a bilateral nephrectomy, both my kidneys were removed. And I couldn't go for a transplant because I had 10 units of blood infusion that had happened. So I developed antibodies. So during that period is when I first time, the doctors were like, you have to monitor your potassium levels and your KFT. Because so the diet restrictions were there. There were lots of things. That's when I realized almost everything is potassium, and which is generally good for health because it's good for your blood pressure and all that. But at that time, I couldn't have potatoes, which are my favorite. I couldn't have tomatoes. I couldn't have banana as a fruit, which is also my favorite. So
incidentally, since you are on that, can you give us some idea which foods are rich in potassium?
So potatoes, tomatoes, spinach, bananas are the 4 things which, at least in my case, and I realized a lot of foods actually have potassium, but these were 4 which your blood takes on a day-to-day basis and have pretty high levels of potassium. And potassium ranges from 3.5 to 5 approximately, and I was there were times when I had to tell them to do a potassium-free dialysis. During my last transplant in March of 2024, I realized my potassium levels had shot up to 6.15 in March, and it went up to 6.22 in April. And the issue that I kept facing was that you can't get your test done every dialysis, right? So you have to sort of make an estimate that, okay, I had this and this could have gone up to this much. If I tell these guys to do a potassium-free dialysis, it might go low. So somewhere in between, I also had gone through, 5 dialysis consecutively when I had pneumonia. And I had gone to the hypokalemia stage where my potassium levels had fallen below 3.5. And the doctors were like, you will have to go to the ICU again if you don't quickly get that back up. So it's such a...
So you are saying it
balance.
was just an incidental detection. Incidentally, just a acronym to remember. Remember potassium, because you were talking about potassium. P stands for potatoes.
Yeah.
All right. Then O stands for oranges.
Yeah, oranges, of
T
course.
stands for your tomatoes.
Yeah.
Then A is for avocado.
Okay.
And then S is for strawberries.
Okay.
I is for fish, if you are taking. And then the mushrooms and muskmelon and all.
Yes.
They are rich sources. So just remember the word potassium.
Correct.
So you know these are the potassium. Otherwise, you said absolutely right. So one of the important factor which you mentioned, that it was incidentally picked up.
Yes.
That is an important thing. And you said, how much was the potassium?
6.15 in 1 month, and it went up to 6.22 the next month.
So this is what we call actually mild hyperkalemia.
Correct.
That if it is something like 5.5 to 6 or 6.5, I'll say up to 6, we certainly take it as mild.
Sure.
So 6 to 7, we take it moderate, and over 7 is severe.
Correct.
So one of the important factor is that it is incidentally picked up. One doesn't know.
And because one has so many, in terms of symptoms, as a CKD patient on dialysis, you have 1,000 symptoms. So you have headaches, because headaches are mostly because of sodium imbalances, and you have nausea, and you have, your weaknesses. Now, a lot of these symptoms overlap with a high potassium symptom. So it's very difficult to tell. But of course, you know that this is something which will affect the heart. So you are careful. And of course, what you mentioned, one more thing, which actually my doctor also said that, a lot of times these people, the phlebotomists, when they come to take blood, they hit at the veins to get the veins to come up. And I was like, don't do that, because that's going to, mess up my potassium readings.
Yeah.
So, and most of these phlebotomists don't know that. So I think that's another set of people who need to be taught about this.
This information is new for me.
I think I'll ask Mr. Kumar,
Yeah.
Mr. Varma. He's an engineer, and he is on dialysis for almost 10 years now.
Right, yeah.
I'm sure in your history of dialysis, you must have developed hyperkalemia a couple of times.
Yeah, absolutely. So, first time I encountered when I had office party yesterday, one day, when I faced that, one day before I had the party, and that day I started feeling, very weak in my body. My heart is sinking and all. And I was like, it was happening first time, so I was not able to, correlate that why it is happening and all. And fortunately, that day my dialysis was planned. So I just went there to hospital, told them. And even I was so weak that I could not walk till the, dialysis unit. I had to take the wheelchair, and I went there. So, my nephrologist has, diagnosed quickly, very, very quickly, because they know this kind of things happen with the patient. And that day my dialysis was done without potassium. It's like potassium-free dialysis. And after 1 hour, 2 hours, I got settled. And after 4 hours of dialysis, I was quite well, feeling well.
So you could walk it to dialysis center that day?
No, I had to take the wheelchair, because
What was the potassium?
That time, that day, it was 7.3.
That is an important message, I think, we need to communicate to the audience that, look, the symptoms of hyperkalemia are very varied. Like Mr. Shantanu was mentioning, with mild hyperkalemia, he never had any symptom. It was incidentally detected. That is the commonest way you are getting picked up. But if a person is having hyperkalemia, which is moderate to severe, there can be weakness. Because for every muscle contraction or nerve activity, you require potassium. So if the potassium is gone haywire, so there is muscle weakness. There can be neurological nerve tingling, numbness can be there. Person may feel extremely weak. And as you mentioned, that if it becomes severe, then it starts affecting the heart. And that is the time people can develop palpitations, or they can develop bradycardia, heart rate becomes low. There can be arrhythmias, different, the rhythm of the heart goes. Sometimes people can develop cardiogenic shock, and it can be life-taking at times. So keep in mind, it may be mild cases, incidental, moderate to especially severe cases, it becomes a medical emergency, as you had weakness, you were not able to walk, you were pulled on wheelchair, brought to dialysis, and you gave the answer that dialysis is one of the finest modality to lower the potassium in a very rapid way. Yeah. So that is one important aspect he has mentioned. Now the other issues which come, that suppose a healthy person develops hyperkalemia, how common will that be in your view?
Yeah, sir. Actually, I remember that when I was before dialysis, almost for 4 years, I was CKD stage 5 patient. So that time, doctor told me that there are certain potassium binders which we have to take if there are certain potassium levels are high in the reports and all regular reports. So that is something they have suggested.
Yeah. So that is one aspect you have brought out, that if a person has developed hyperkalemia, what are the ways to get rid of it? You told the symptoms.
Okay.
How to get rid of that? First, logically, as Shantanu was talking, that I think Mrs. Vasundhara Raghavan is sitting quiet for quite some time. You can mention something. She is the founder of Kidney Warrior Foundation. You brought out a book also, I think, about potassium. Something.
No, we brought out a book which is The Nutritional Secrets. And we were working on this project in 2017. And we were almost releasing the book when we found that Indian food composition tables were available. So our dietitians had to rework on that book to change all the potassium vegetables and fruits so that it's very authentic. So this book talks about how to manage diet. What is the lower potassium vegetables, fruits, which are the medium ones, which are very high. It's also about the grains and the lentils, pulses.
Yeah.
So
that you have to know how much potassium. As we mentioned, that a person requires 3,700 milligram of adult potassium. In kidney patient, we say restricted to 2 grams. Like salt, we say that WHO recommends the sodium chloride salt you have to take 5 grams a day.
Yeah.
But kidney patients, we say restricted even further down. So therefore, important thing, as you rightly mentioned, you have to know. One banana itself contains 450 milligram.
Yeah.
That means 1/4 of the requirement of potassium is coming from one banana. People are very fond of taking coconut water and juices. A glass of orange juice will have more than 500 milligram of potassium. So one has to be very aware, very kind, very nice of you that to bring out that awareness among the masses. So coming to, one is potassium-rich food should be avoided if we are talking. And as we mentioned, you mentioned all the foods which are rich in potassium, all the juices, coconut water, bananas, tomatoes, oranges, avocados.
In fact, I was not aware of potassium binders. We had phosphorus binders as CKD patients. I was actually used to wonder that I don't have potassium binders.
But we will come straight. I'll answer here. We have got potassium binder also, which is there for long time. This is actually sodium polystyrene sulfonate.
But it
So
was never
this is
prescribed
what
earlier.
we say K-bind commonly.
Acha.
K-bind or different bind.
Yeah.
Yeah.
K-axylate.
K-axylate. So these are different names. What it does is you give this in the
It
gut.
removes it from the bloodstream and passes it to the
Nothing
gut
to do. From the gut, it will bind with
Bind
the
it.
potassium
and remove it
and
from the body.
remove it in the stool.
Yeah.
Keep in mind, this is good but bad. Bad, why? Because especially if elderly are taking it, and many people take it with sorbitol as a laxative. FDA banned it, that it is not to be taken with sorbitol. So the drawback is it can cause colonic necrosis.
Oh, okay.
So for emergency, I advise to my patient for 1 day, 2 day, 3 day, you can take it, but don't make it a regular affair.
Okay.
But there are 2 more salts. One is petyromer, and second is sodium zirconium cyclosilicate. This is cyclosilicate. These 2 are about to come to India. They are still not in India.
Okay.
They are freely available for last 4 years in the Western world. They are still not available in India. So these are the actual ways which will remove the potassium. And these have been tried for months now in patients, that there are certain medications which you have to take. If the person is getting heart failure, he has to take spironolactone, or ACE and R1 has to take.
Or BP medicines, of course, which you have to take, and they have potassium.
We have to take. So for that, then along with that, you keep taking these potassium binders. So people keep healthy, and the trials have been done for over 12 months now. So they are safe. They are about to come to India. So the best ways to remove will be, 1, take diuretics. You take Lasix or these tablets, so that through urine it goes out. If a person is having urine output.
Doesn't Lasix also have potassium?
No. Lasix will throw the potassium out. Lasix and Ditor, they are diuretics. Diuretics means to throw the sodium and water out, and potassium also leach.
Another thing is, if there is some way that we could test potassium just like we test, sugar or something on a pretty regular, either in the dialysis machine, it would automatically check for potassium levels, or, I was in fact that day, one startup founder, he had developed something, he had come on Shark Tank also, and I had suggested, he was asking what medical devices do you think can help CKD patients. I told him, the first thing I told him is potassium is the only thing. If there is any device that can detect potassium.
That's very interesting. That is an advantage from taking a patient's perspective, that what generally one feels, that yes, the potassium. So one, we said, if the person, but CKD patients are not passing urine. So all the Ditor, Lasix are of no use to them. As I mentioned, 90% can get removed through the kidneys, 10% only is gut. So what we are talking about, petyromer or zirconium, they will remove the other portion of potassium. And when emergency, you said you have already received dialysis. So these are the modalities which remove potassium. You said other modalities are, don't take potassium at all.
Right.
Right. That is wonderful. Dietary restriction. Second, in between aspect is, you push the potassium away. As we said, that place of potassium is inside the cells. So if the potassium is more in the blood, you give something so that it goes into the cells. So that is the time what you generally give. The best portion is calcium gluconate injection, calcium gluconate. Calcium chloride also. Calcium chloride is irritant. It has to be given to the central vein. But calcium gluconate you can give in any vein. So if you give it, action is fast, in minutes. The membrane of the cell does not get depolarized, so you are protected. Life-saving is calcium gluconate or calcium chloride. Other things are, we give insulin to the people. Now, when we give insulin, the drip, insulin again pushes the potassium into the cells. So that is, keep in mind, these are not like then inhalers. They are also useful.
But that means people who are diabetics, who automatically take insulin, they are supposed to take insulin, that they would not face this problem.
They should have lesser. It is a remedy which will push the potassium into the cell. But I keep in mind, these are not removing potassium from the body. They are only, you are buying the time that it is getting pushed so that you can take some other measures, dialysis or other measures, till the time it is there. What problem? I think she's an expert to answer some of the things. Let's say the dialysis wise, once you are still receiving dialysis.
Yeah.
Did you face any problem as far as, let's say, finances are concerned?
I mean, of course, because dialysis is very costly, and I have to go through thrice a week. And even, sometimes in the day, I do feel, pain in my calf areas also, because if potassium is high, there is a muscle pain in my calf areas also. And I think from the finance point of view, insurance is very important thing. And I was fortunate enough to get a corporate insurance because I'm working. Although when it comes to getting a private insurance, it's very difficult for the patient like me. Although insurance company do mention that there is option of pre-existing disease patient to get the insurance, but normally in reality it is being denied. I've tried twice, thrice, but I've been told that either you exclude the current situation you have from the insurance coverage, otherwise you will not have. So this is what the current situation, and I think that insurance is quite important thing when it comes to support to patient who are hyperkalemia, or majorly I've seen that people who are on CKD having mostly this hyperkalemia.
Yeah, you are right. What you said is that once the insurance company knows that you have got CKD, logically they will not insure you. You are not getting insurance cover. Your viewpoint, Vasundhara.
I think, one thing we have to note is, since he has got corporate insurance, he is able to manage hospitalization due to hyperkalemia. There are many people who have to somehow manage even the dialysis costs. And then they have to somehow manage the failed fistula. Then they have to somehow manage hyperkalemia. So, there has to be some way the government can address this. The government can allow the insurance companies to take a higher premium with a longer wait period. Anything is useful for them, because you see, patients feel the burden of managing the disease even normally. The medicines are expensive. The dialysis is expensive. Post-transplant medications are expensive. And everyone says, we are getting 20% discount on medicines. But what is the exact amount you're getting? Is it a waiver of a GST? Is it anything that you can really say that the patient has benefited?
I got the point. I think this is not really the discussion point today, because today we are talking about hyperkalemia, but in between the topic came that dialysis is required sometimes. And Pradhan Mantri Yojana and different states are having different insurance policies. The government is giving. Lot has improved. There's no doubt. If you talk of 10 years back or 15 years back, it was practically impossible. There were no dialysis centers actually.
Mm-hmm.
It was impossible to get all these things done. So government has done a lot.
Mm-hmm.
There's no doubt. All the state governments have done fantastic job. But as Vasundhara ji is rightly mentioning, some more is needed. Many times these privileges or benefit go to underprivileged or below poverty line, or this limit is set, but possibly that is not required, because this is an expensive form of
I would
treatment.
like to add to this. See, one more thing that I think the government can help is just educate people that they need to insure themselves medically. A lot of people ignore this part quite a bit because everybody feels that nothing major is going to happen to them and all that. But the point is, like, I took my insurance way back. In fact, I think 11 years before I went on dialysis, I had an insurance. And that also, just because my insurance agent, I was getting my mom insured. And for at least 10 years, she was on insurance. And the insurance agent said that, why don't you get yourself insured? I said, my corporate covers me for unlimited insurance. He said, tomorrow, if you leave the job, that goes. So he pushed me into it. And luckily, I took it, but I didn't take a large amount. I just took, I think, 5 lakhs base policy. And then after a few years, I took another top of 7 lakhs. So I just had 12. When I hit that dialysis period, and then it stops, then you can't increase it. So the point is, because I had the 12 lakhs, at least that is there, and now whatever happens, at least I have that 12 lakh thing, which is there. I can mostly have been able to afford all my, expenses. So it's not so much of an issue. But the point is, it is an expensive disease. Mostly, as you said, hyperkalemia, 90% are CKD patients. CKD patients have to pay for a dialysis of average in any hospital is around 4,000 per dialysis, 3 dialysis sessions a week, and plus the doctor costs and the medicine costs. And medicines are a lot when you're on dialysis. And if you go for a transplant, the entire transplant surgery, post-transplant medication, I'm not on much high medication right now, but still my medical costs in terms of just medicines and a doctor visit once a month and the basic tests would cost more than 10,000 rupees a month. And
so what you are saying is awareness.
Awareness of getting insured.
Is getting awareness about the disease.
Right.
For any disease, for that matter.
All the CKD patients, not only CKD.
Any disease.
Many times we get many references that potassium is high, the procedure cannot be done, patient cannot be taken for surgery, and patient will come, you find out that basically majority of the time they are on some of the drugs or the salt substitutes. This is very common. I mean,
correct.
If you don't tell a people, majority of the people, if you start investigating, they are not on normal salt. I think rock salt or senda namak, this is imbibed in them right from beginning that these are good for health. Yeah. So that public awareness to come that, Baba, you have got CKD now. Once you have got CKD, these are not good. Which foods we were talking? Will you like to say something?
Yeah.
That awareness to which foods are not good.
So, once you got kidney disease, the dietitian tells you, obviously, the doctor tells you that, you must avoid potatoes, eat normal food. But so what happens in India is the northern part of India, they combine the potatoes with beans, carrot, or beans and potato, it's bindi and potatoes. So they don't have that vegetable separately. The potato is included in all the food. And that habit continues. In South India, it's predominantly they use lot of coconut. Then if you go to the West India, they use peanuts.
Yeah.
And in Karnataka, they have this masala, which is high in potassium. In Maharashtra also, this Goda masala or something it's called, which is used commonly in all their recipes. That's very high in potassium. So you see, they have to make that change. You have to shift. You have to say, because you see, gradually during CKD, your medications go up. So all of them combine, they drive you into a higher potassium zone.
Very, very right. I think she has hit the point that the public awareness is mandatory, which is possibly lacking. I have got nothing bad for dietitian, but you require renal dietitian actually, who can give the correct. What is happening is, many times we have got same dietitian, she is expert in diabetes, she is expert in blood pressure, she is expert in cancer, she is expert in kidney disease. So logically, then it becomes a set formula. Any kidney patient comes, Baba, you don't take this, don't take this, don't take that. Without knowing, without actually analyzing, one person may be passing normal urine.
Yeah.
Potassium is not a problem. I think you were narrating sometime that you went into hypokalemia.
Yeah. So in my case, I was admitted to Fortis Gurgaon last year, 2023. and I had water in my lungs. It was pneumonia, and because of that, they had to put me on continuous dialysis. So I had dialysis 4 days continuously, then a gap, and then 5th day. So by the time that was over and I was getting discharged, my potassium levels had fallen down to 3.5. And the doctor was like, see, this is again something which will put you back in the ICU.
That is, again, you have brought out a very important point, that for treatment also, whatever you are giving, you have to be careful. There are some side effects. So that is, don't go overboard. You are correcting hyperkalemia, that you go in hypokalemia. Likewise, sometimes you give insulin, as I mentioned. People go into hypoglycemia.
Right.
If person is not a diabetic or something, a healthy person, you have given 10 units bolus of insulin, person is going into hypoglycemia. So keep a watch. That people, when you are treating hyperkalemia, one should not go overboard.
Actually, I'll tell you one perspective here from a patient's point of view. It's very difficult for an ordinary layman family or a patient who's not aware, not well-read, to understand that at every stage things are changing. So in a pre-CKD, pre-dialysis stage, you have a certain diet. The moment you're on dialysis, the diet, and that pre-CKD, when you're a CKD patient, the diet is normally opposite of what a healthy person is supposed to have. So the things which are considered healthy are suddenly unhealthy. Then when you reach dialysis stage, then things are totally different. You need to again take high protein, which you were not allowed before that. So at every stage, people also get confused at what is happening. Till yesterday, you were telling me not to do it.
I totally, 100%. This is a patient's perspective. That is the advantage of having a patient along. But that is truly, he says, they were healthy, they were taking normal diet, good protein diet. Once they developed CKD, we never tell patient not to take protein. We don't reduce protein. Keep in mind, in India, we are taking as such very low protein diet. If you analyze ICMR data, normal recommendation is 0.8 to 1 gram protein per kg body weight. We all are taking less than that because we are all vegetarian by and large, majority. So, but still, it is imbibed by dietitians, low protein diet. So you carry on with a low protein diet. Half the patient who land up on dialysis, they carry on with that low protein diet. Unless it is told to them, Baba, now you take high protein diet. So,
may I just intervene?
Yeah, please.
The low protein diet is not low protein. It's a low portion. So you need to have a smaller portion of that high quality protein. That is what our renal dietitians are saying. But when they say low, not have protein, or they have to have very little protein.
No, the original studies which we say when a person is CKD, original studies were 0.6 gram protein diet. And then they went to very low protein diet, 0.3 gram per kg body weight with keto supplements. So the studies were there that time, but that is not analyzing that we are not taking 0.6 gram protein diet. We are hardly taking that diet. So Indian scenario, we don't really need to reduce the protein.
Because mostly it's dal, which is a low quality protein.
And what Madam was trying to bring out, that whatever protein you are taking, 50% of that should be high quality protein. That is the animal protein, whether from milk or non-veg food. And 50% should be other protein. That is a recommendation for population or dialysis patient.
Even I think that, for diet and body, this is something should be part of our education system. So that we know about these things from when we start our education. And it really requires a generational change to bring that kind of knowledge to the masses, because it is very difficult that at a certain age when you get the illness and then you try to start understanding things, because you already created your lot of, assumptions already. Now you have to change a lot of things. Like he said that, the day you diagnosed that you are CKD, the things which were normal, healthy for you, which is not now.
So one would assume that having awareness of that is one aspect. The other aspect is to actually put that awareness into action, which I'm sure requires a mindset shift.
Right.
And for a patient already suffering from a condition like this, what would you say to somebody who's listening and is suffering from this currently? What helped you make that mindset shift? Is it completely done, or are you still, sometimes in the process of, let me just indulge in this? Or is it, I mean, how?
Yeah, so that will always happen. Yes. So we do want to indulge in it sometimes. Like I was taking oranges until doctor was like, please don't. I mean, I was like, at least something I need to, I can't have bananas and I don't like papayas. They said, no, you can have papaya. I said, I don't like it. So, you do, but obviously then you also test. And when the moment you see your test report and say, it's okay, it's normal, let's quickly take something before it goes high. And then you say, okay, dude, potassium free dialysis, at least I will have enough buffer to have more.
Again, one thing I must tell you, that potassium-free dialysis we generally don't recommend unless in emergency. As I mentioned to you, potassium is good for blood pressure. Many times when you give potassium-free dialysis, patient get rebound hypertension. So we don't advise unless it is emergency that some people come regularly.
I had excessive hypertension during dialysis.
My potassium is 6.5 or 7. They will come tell dialysis technician, give me one potassium-free dialysis.
Yes,
and some of the dialysis technician will give them also potassium-free dialysis. But we don't recommend
it is very
that.
normal in dialysis center, what you are saying.
We don't really
Everybody
recommend.
says every patient is a doctor, every dialysis technician is a doctor, so everybody does self.
So I think we will just summarize what we have been discussing so far. The message points or the bold points will be, number one, hyperkalemia is not an uncommon thing. Especially the severe hyperkalemia can be dangerous and can be life-taking. It has to be recognized early. Second bullet point, you said, most of the time hyperkalemia is not picked up routinely unless you are doing a ECG or a routine lab test. In patients who have got mild hyperkalemia, they may remain symptomless, or some small symptoms, they may not pick up small weakness or something, which is pretty common in kidney patients. However, if it is a severe hyperkalemia, there can be palpitations, there can be bradycardia, there can be shock, which can be dangerous. So we have to pick up that. And treatment-wise, besides avoiding potassium-rich food, excretion of this potassium, if the urine output of a person is good by diuretics or by potassium binders in the gut, or emergency state dialysis can be offered. And especially in emergency situation, we don't forget to use calcium gluconate IV, which has very fast effect within minutes. One can give insulin, glucose insulin drip, which again, and really bicarbonate if a person has got acidosis, it'll be useful. From the patient's point of view, the important message is coming that there has to be more awareness about the foods what we eat, and there should be a continuous information and knowledge. I think that is the whole purpose of this session today, that we should be aware that hyperkalemia can occur. We should be aware that these foods, potatoes, the melons, you say strawberries, tomatoes, oranges, juices, these need to be avoided, because otherwise you are risking yourself. And sometimes people, kidney patient, go with the idea, today is a dialysis day, before that I should take a juice, everything will go out. Yeah, let's not have that. So let's make it a habit to avoid. I tell you, I have got a patient, she's a doctor. She's on dialysis for almost 11 years. Her urine output is 0. But she has never gained even half kg weight whenever she comes for dialysis.
How is that?
It is something like a self-control.
Okay.
She has made it a habit that every day you are losing half a liter.
Yeah, maybe metabolic system is high.
So it is something like she has learned to live with limited amount of water or liquids. So you have to learn, as you, Shantanu, was bringing out, how can I avoid oranges, which I like, or banana? So you have to possibly modify the life, that we have to avoid these foods, which can prove dangerous for us. So that is what.
I have to add one story.
No, everybody has to add.
Very interesting story of this gentleman, Paramjit from Ahmednagar. He was a truck driver, and suddenly he got chronic kidney disease. And for, I think, 18 or 19 years, he's on dialysis. As soon as he was detected with CKD, when he was hospitalized first time, he said, I sat and ate everything, pickle, papad, whatever things were told that I should not eat. And thereafter, I have managed to eat everything in a very limited way. And for 19 years, he's never been hospitalized at all. He's only doing dialysis, going back home, no hospitalization, no fluid overload, no potassium hyperkalemia, no nothing. So, these are like your patient.
And these are such real patient stories that help us understand how, a regular person can, once they get into this journey, how to go about it. And
if we just do that. So, there are lots of vegetables that you can really have. Like you can have the bottle gourd regularly. You can have capsicum, onions. All these are regular things. You can have that in
I think you have touched very important point. I think that also I must address about the leaching. Keep in mind, leaching is an excellent way to reduce potassium and phosphorus. Lot of experiments have been done with meat, mutton, and we did experiment with all the vegetables and pulses. I remember I was that time in Indian Liver and Biliary Institute. So that is the time we brought whatever the seasonal 20 vegetables, whatever was available in market, and we brought all the pulses. So we tried to keep them in the normal way. After cutting the vegetables, we put it in water and soaked it and kept it for half an hour. There was nothing came out. There was no potassium in the water what we had. But when we boiled it and then removed it, some amount of potassium leached out. But in pulses, it was significant. It was almost 30 to 50% of potassium came out from the pulses or lentils. From vegetables, on boiling, there was some
blanching or something.
Yeah,
it's called.
but boiling, there was some leaching of potassium and phosphorus, but otherwise no. So keep in mind that if you are trying to do the leaching process from vegetable, one vegetable has to be cut in very, very, very small pieces. Then you have to boil the vegetable, some amount will come out, but lentils, certainly with one boil, you throw the water, taste does not go bad. An important message you also note, there is no protein loss at all.
Okay.
Some people have the idea, well, we have boiled the vegetable, everything is gone, all the nutrients have gone, nothing goes. Protein stays. There are a lot of experiments on mutton with potatoes and other things that nutritional value stays. It is only the potassium and the phosphorus leaches out. So it's a good thing if you can practice, but keep in mind, just washing with water, don't expect potassium is going up.
So, doctor, as you rightly mentioned, this is something that a lot of us, if we have the awareness, can do at home.
Yeah.
But in how we're technically advancing in medical healthcare, etc., what are some of the new innovations or advancements that are now available to kidney patients, to hyperkalemia patients that we might not know of, things that haven't come to India yet?
Yeah, that is what I mentioned, that one is the potassium binders. So far, we have been taking sodium binders, K-bind and all these bind. These are not very good for the long run. They may be used in emergency for a couple of days. As I told you, zirconium and ptyromer. These are two molecules which are not absorbed in the gut. Once you take it, the dose is almost 10 grams 3 times a day you have to take. So they bind the potassium. They lower the potassium level by 1 milliequivalent or even more. So that is the future now, that hyperkalemia incidence will come down. Not all patients of kidney patient develop hyperkalemia. Like they have been on dialysis for 10 years. Maybe in these 10 years, you might have encountered hyperkalemia 3, 4, 5 times. So it's not everyday hyperkalemia occurring, but if people are prone to that, urine output is nil, a person is not sticking to the diet. So these are the substances, salts, which are about to come. I mean, one of the salt, what I said, zirconium, is about to come in the next 2-3 months in India. So once these are available, the patient's management of hyperkalemia will become easier.
And doctor, these molecules we can take like regular medicine?
Yes, that's what I said.
Not like...
the trials are there up to a year that people have taken daily these medicine. They have not caused harm.
Okay, and it was maintaining?
They are maintaining.
Right. And I think I will now just move to ma'am. Ma'am, you mentioned the story of Paramjeet who, and how he got diagnosed and his journey. How do you think patients themselves can become advocates? And you mentioned rightly on awareness and how important that is. So what change would you like to see in hyperkalemia awareness in, say, the next 5 years?
I think basically if people are more conscious about, the little change in the food habits, like not having a certain vegetable or a fruit and maintaining that, and then slowly taking a small portion, instead of saying I'm totally avoiding it, but taking it in a very small portion just for your own taste and joy or enjoyment of that food. So that type of a habit, if they form, then they may not get into a problem. Like, even the dietitians don't say that you should strictly not have potatoes. They say, okay, you want to cheat, you can have it after, say, every 3 weeks, you can have some potato. But if we make it a daily habit and it's like, also the portion size, how much you eat. You can't just binge on it. So these are the small things. If they take precautions, it will be useful for them.
And if I can add on this, from the patient's point of view, I think that, whenever you get diagnosed with this kind of disease, first thing is that you accept that disease, that you got into this, first thing. And then,
but that is not easy, as you know.
It's not easy, but that should be your target.
Most people go into denial mode initially.
Very right.
Yeah.
That for a couple of days, there's a denial mode.
Yeah.
Some people don't trust the doctor, what he is saying. They will go to alternative medicine group.
Yeah, exactly.
So, but it takes few days to sink in.
Yeah.
I see most of my patients, they cry for 2-3 days.
Yeah.
But then gradually, and this is a huge shock for a person. I mean, I can only say that you have experienced, both of you. You know that it is a big shock, but gradually one gets used to it.
So like in my case, when it happened to me, so first it is denial, but when I accepted it, once you accept, then real action starts actually. So what I can do, right, to my situation. So I started to gather the knowledge by talking to my doctors, maybe relevant dietitians. So I started to gather the knowledge, and also I started to gather knowledge about that if this condition, how it can be gradually cured or maybe maintained. So that is, I have to know what kind of solution I have about this kind of situation. So that is very important. Once you have the awareness, knowledge, you can get into the right direction. And I understand that every body functions differently, right? So maybe whatever dietitian suggesting you could be a little different for you because your body is functioning different. Maybe you're like you mentioned one example wherein even you taking certain potassium, it is not harming you much, but maybe the same amount harming others very much, So watching your body is very important. That is what is happening with you. What are the symptoms? You ensure that you observe that if anything happening, any symptom, there is frequency to it, what is happening. So that is something you have to discuss with the doctor so that you get the right support then and there. Because many times things happen when the symptom happen first time, people will ignore because they don't know why it is happening to me. So watching your body, observing your body is very important. What is saying to you talk to your body. I mean, it is very important for you. So, I mean, after accepting, people start doing this. So, gathering knowledge, observing your body, these things are very important, I think. I mean, then your journey as a patient, I think become little easier. You can maintain it. And even I think that I've seen that many times, especially I've seen elderly age patient, if they get into this chronic disease situations, so they don't want to take care of their body. They sometimes caregiver also try to get the knowledge, give that support to that patient. But I think that patient also have to put the effort, because it's very important. It is with your body, so it is you. So you have to put more effort to understand it and work on it.
I think it is a great insight for anybody listening to you who's suffering, or any caregiver who's actively trying to seek new ways to help out their family members or their loved ones. I think this conversation has been extremely insightful and informative, and I'm sure it'll create a larger impact on anybody who's new to this world of hyperkalemia. As we sum up, are there any messages that you have for our audience? Anything you'd like to say to them?
I'd like to add. I think joining Kidney Warriors Foundation will be very useful for people in the journey of chronic kidney disease. We have groups for dialysis patients, for transplant patients, for people who are on CKD, and they get guided through dietitians. We have renal dietitians, a panel of renal dietitians. We have books on diet. And like Sambhav has been talking about his experiences, most of them are being discussed in the group. Patients are discussing all these points. So, in our patient advocacy, you talked about what we want from the what we believe the patients should do. They are good. They have a lot of information. They can be actually used in the hospitals for motivating other patients. And giving them knowledge and sharing their
this support is really helpful. I mean, I would say
so. It will help them, even if their doctors are inviting them in the hospitals to talk about it. It's good enough, because that is how the learning will improve.
Yeah. How many members are there of your?
We've got about 4,000 members in the WhatsApp groups. We have city-wise, state-wise. We have these other groups. We have dietitians group. We start planning what can we do with the diet, what are the sessions we can have. So it's a very active participation, and patients learn through these experiences. And I've been discussing with nephrologists to say that please take our patients, let them come and talk in the hospitals. They can motivate people who want to have a transplant. They can give them suggestions on the diet, because they have a lot of information through the experiences of people across the country.
Of the community.
Exactly. This community support is very helpful. I mean, many times, you cannot get the doctor immediately. Although in the group, it is quite mentioned that you have to take final advice from doctor, but at least there are people who can tell you that, okay, I gone through this situation. There are this kind of possibilities. You can discuss with your nephrologist or whatever doctor you want to. But I mean, this really helps. And even sometimes, even I myself got many calls from different CKD patients because maybe they are not on dialysis, but they are about to reach. And even when I started my dialysis, the one person from the group, Mohit Dhawan, he was the person who supported me that which dialysis center I should choose, where the dialysis with right hygiene is happening and all. So he supported me very well. I mean, this group really helped me in my journey. My doctor also really helped me, because I remember when first time my creatinine reached to 8, he really suggested me that you should go for your fistula. So I got my fistula on the very right time, two years before the first dialysis happened. So I was full ready, full information. So I mean, this was really helpful.
I think that's the importance of early detection and just having a community that can help you in your journey. So, ma'am, Shantanu, how can people become a part of the Kidney Warrior Foundation? If somebody
we have a Facebook group where people just have to answer a few questions that what is it that they're suffering from, and a few details, and then we admit. I'm one of the admins there, so we add them in. A lot of people, unfortunately, when they come in, they just apply and they don't put in those details, so we're not not able to accept them. But we get almost 10-15 applications every day. As a member, you get a lot of benefits because we have all India tie-ups with, say, labs like Metropolis and Dr. Lal's, where we give them 30% discounts on diagnostic tests and things like that. And there are other tie-ups that we are getting into. And plus, of course, access to all the reading material. Plus, as a community, we are helpful. So we have books which KWF has published. We have 2 books on the stories of patients, at least 50 patients each time, 2 editions of that. I have my book, which is there on the website. So I was diagnosed way back when I was 24 in a regular health checkup. And the doctors said that, okay, you know that this is what you have, you have ADP, KD, and, stuff like that. So, and as I was telling, I went into denial mode immediately. I just pushed it to the back room, didn't even tell my family about it. And in fact, I focused on my career, and I was heading HR for Oberoi Hotels in one of the hotel, and our doctor, in-house doctor, he was checking my BP and it was very high. He said, Shantanu, your BP is very high. I said, forget about it. So let's not talk about it. So I didn't go for even a BP medicine till one of my pre-employment health checkups, the next company. They said, no, we will not. Doctor said, I can't give you a clearance until you start taking BP medication. And I had this thing that I was waiting that, okay, when will it? And I also went for alternate medicine, which was one of the biggest mistakes. Unfortunately, groups like this were not there that time. So I went for alternate medicines, which immediately caused kidney failure. So again, through this channel, I think I would advise people never to go for alternate, medicines and things like that, which promise a lot, but are totally, misguided. And
in CKD,
not at all.
Not at all.
Just go to a proper nephrologist.
I think that's a very important message they are giving
to
very
the
important audience. That I personally feel that whenever a person gets diagnosed or he's made aware that he gets a shock of his life, which is not easy to accept it besides denial. And these groups, like the Kidney Warrior group, are talk to your good dietitian. I underline the word good dietitian, because many times it becomes routine, whatever is the prescription. You go to hospital, everything, you stop this. That is how the patient gets frustrated. What should I eat then? Is Baba, you take, and many times you come to the patient who are taking only Loki Tori for life. Because they only give, this is a blind, whatever advice is given uniformly to everybody, not realizing somebody is passing good urine, somebody is passing less urine, somebody is not prone to hyperkalemia, somebody is prone to that. So you have to take individualized approach. What a person needs, what Mr. Verma was mentioning, that everybody is different. You can't take everybody the same person. So you individualize the therapy, what suits a person. So that is, you take a help of such groups, take a help of good dietitian. Your doctor is always there to support you. I think the support groups are mandatory to move forward. And Google these days gives, you have to filter the knowledge correctly.
Absolutely.
So that filtered knowledge, which is going in the right way, that makes you stronger and makes you confident to accept the reality of life and to know that the future is not dark. There is bright light ahead. And I think if we stick to all that, we can do good.
Thank you so much, sir. I think that's very rightly said. And honestly, as a layperson, the one advice that I have to give is not to Google your symptoms, because every time I have done that, it's not been a good aftermath of it. Thank you so much to all our speakers, Dr. Ma'am Vasundhara, and our patient advocates for being with us today and talking us through their journeys. Your insights, your candor has been deeply meaningful, and we hope that this helps all our listeners out there understand more about hyperkalemia and know that in this journey, they are not alone, and we are here to support them in any way that we can. Please stay connected with us at the IHW Council in association with AstraZeneca as we work together to raise visibility of hyperkalemia and champion kidney health for all. Thank you very much.